welcome to the show.
Hi.
If you want to introduce yourself and tell us what you do.
My name is Minette Galura-Boquiren, and I'm a registered dental hygienist and oral facial myofunctional therapist.
That's quite two different career paths.
Correct.
How did you arrive at both of those, or what was your journey?
So I've been in dentistry for over 20-something years, and I started as a dental assistant, became a dental hygienist, and, it was always rewarding to me when patients would always thank me, oh, thank you so much for making my mouth feel so clean, so healthy, and, that was great. But as I look in these mouths, there was something more behind just the teeth, looking at everything altogether, looking at the mouth, the oral cavity, and I began to see a lot of stuff of dysfunction, right? And how that mouth related to the whole body. And that's how myofunctional therapy came into play. The doctors that I worked with were really focused on whole body health, airway, TMJ disorders. So I got to really see with how the mouth really connects to all these different things. And myofunctional therapy is about getting to the root cause of a person's dysfunction, whether it is issues with mouth breathing, issues with the tongue not being able to move, issues with the facial muscles. So it just intrigued me to look beyond the teeth and really look at what is going on with the patients and how I can even help them even more than just giving them a nice smile, right?
What made you become a dental hygienist?
So as I started as a dental assistant, it's funny because I didn't think I was going to be in dentistry. I started out in research and development when I graduated college, and I thought, oh man, I don't want to be in a lab for the rest of my life. I wanted to work with people, work with patients, and so I had an aunt that was in dentistry, and so I was like, okay, let me see what I want to do, right? And she's like, come into the office, let's see what you're doing and see what I'm doing, and I loved it. I loved being around patients, being able to help them. So when I started dental assisting, I loved it even more, and I wanted to continue my education. So I wasn't sure, should I go into dental school or should I go into dental hygiene school? I actually applied for both dental school and dental hygiene school, and dental hygiene school said, oh, we have a spot ready for you, come in. And I was like, well, should I wait for dental school? And then I said, no, you know what, this door probably opened for a reason. And I became a hygienist, and it was probably the best thing, I would say is the best thing that ever happened to me, because then it led me, like I said, down this path to become a myofunctional therapist. And I could do so much more to help my patients. And, honestly, patients like to see the hygienist more than they see the dentist anyways.
I agree. You spend a lot more time talking with them and connect with them a lot more. The dentist comes in a little bit later. And
we're like the hairdressers. They tell us all this stuff. And then when the dentist comes in, they're like, quiet. So.
Oh, I bet people tell you all kinds of stuff.
Yeah.
So how did you find out what a myofunctional therapist is? Well, I guess actually let's start with, what is a myofunctional therapist?
So a myofunctional therapist is, think of a personal trainer for the oral facial muscles. So anything from your head and neck, all those muscles in the mouth, the tongue, the lips, the cheeks, and how they all relate together, and retrain with the myofunctional therapist helps the patient retrain those muscles for proper function. And so a lot of times we find out, okay, how do they function improperly, right? What is the dysfunction? It could be something as simple as there's a tongue tie present that they don't even know about. It could be something that they've been breathing improperly all their lives. They've been mouth breathing all their lives. It could be jaw pain and trying to help those muscles of the jaw relax. And so typical myofunctional therapists have a background in either speech language pathology, registered dental hygienist, or even dentist. And I've even met some myofunctional therapists that are physical therapists. So they have to have a license in another, field, and then they take advanced training in myofunctional therapy to be able to treat clients and patients.
So what's the difference between a speech therapist and a myofunctional therapist?
Speech language pathologists actually focus on speech and swallowing, chewing. Whereas myofunctional therapists, they will focus more on the muscles, and they do a little bit of the swallowing, but if it's real, especially swallowing just in the mouth itself, if they have further issues with swallowing, or then they'd probably need to see a speech language pathologist, because they're more trained in that. And they're feeding speech language pathologists treat from birth to adulthood. So they can start as early as with those infants in terms of nursing and making sure that they're doing that properly all throughout their life, that feeding and chewing patterns, swallowing patterns all throughout the life, right?
And earlier you mentioned tongue tie. So if you want to describe what that is, and then what are some of the long-term effects of it?
So a tongue tie is a tethered oral tissue where it attaches on the bottom of the tongue, restricting the movement of the tongue. And a lot of times, if that tongue is restricted, it can't really move and move around in helping with speech, with helping with chewing and swallowing, not being able to move that food around, and then not being able to also properly rest. The tongue should be resting in the roof of the mouth. And that's really important because that helps with jaw and facial development. If the tongue rests up in the roof of the mouth, that helps expand. We call the tongue nature's natural expander. If it's resting in the roof of the mouth, that helps allow for that upper jaw and that face to develop nice and broad and big. And long-term effects of having a nice broad face and arch and jaws is a better airway. So as you have these broad, wide space, that allows more room for the tongue, allows more room for the patient to also properly breathe better. It also, because the upper arch is the same bone as the nasal cavity, if we have a nice broad arch, then we also have nice broad nasal passages. So the more we can breathe better. And that's what we want. We want to be able to nasal breathe. That's what our noses were meant for nasal breathing. But nowadays you see people commonly mouth breathing. So those effects of having, sometimes people don't realize that they have a tethered oral tissue that can affect long-term the effects of how your face and jaws develop. And long-term, too, that same tissue that's in the tongue, that runs from the tip of the tongue, runs all the way down to the tip of the toes. It's that connective tissue. And a lot of times when there's tension here, you can find tension in the rest of the body as well. The human body is interesting because it will compensate throughout the years, and you'll find building compensations of their neck or their neck or shoulders off because of sometimes the tethered tissue.
So what do you do if someone has a tongue tie then?
So we will refer them to a release provider. That can be a dentist or like oral surgeon, a ENT that would release the tissue. Really, really simple procedure. But the most important thing, besides the release itself, is to prepare the tongue. It's a muscle, and you want to prepare the tongue by retraining that muscle. So certain exercises to move the tongue, mobility, elevate it, and get that tongue ready for the release. You never want to release a tongue if it hasn't been prepared, because you run the risk of it just being floppy and it could fall back and close off a person's airway. So the important part to just have, before even having a tongue tie release, is the myofunctional therapy, retraining the tongue, the lips, even proper nasal breathing, so that way when they do have that release, the tongue already knows where to go and what to do.
That makes sense. You build up a little bit of motor control first and
Correct.
some awareness, and then after that is when you increase the range, and then you continue to build on the range you already have.
And then hopefully the goal is rehabilitate, right? That the tongue knows, oh, this is easy. This is where I should have been doing the whole time, you know? And that affects, if the tongue rests in the palate like it's supposed to, and our lips are closed, and we're nasal breathing, that's our oral rest posture. That's how we should be functioning all the time, if we can.
So that's normally something that's worked on earlier rather than later, right? The tongue tie?
It depends. If it's caught early enough, yes. But there are times where I have, worked with tons of adults, even myself, had my tongue tie release only just 2 years ago, because nobody knew back then and nobody identified it that, oh, it might be tethered a little bit, but that's okay. She'll grow out of it. right? That's what I hear a lot. And even some parents that come to me, they're like, oh, I was told that they would grow out of it, but they haven't, and it's still there. So that's why it's important to educate all providers, pediatricians, lactation consultants, dentists, to look at, besides just looking at the tongue, looking at what all is there, what's the connective tissue, how is that going to impact that patient, even though they're a baby, how is that going to impact them as an adult?
So being an adult and going through the tongue release, how is that different than when you're younger?
So being an adult going through a tongue tie release, you're so much more messed up, right? And I say that only because my body, and this is just from my own experience, for so long has been compensating all this time. And just as my own personal story, I have had TMJ for years. I would, even as I think back now, even as a teenager, I would have headaches, and I never knew. Maybe it's just lack of sleep, too much caffeine, who knows, whatever. But I had TMJ for years. And so I went through 3 different night guards, still didn't really help. Always still had the pain, the clicking, even the headaches every morning. Fast forward a little bit as I'm getting more into this TMJ disorder, that I also found out I had an underlying sleep issue. And my airway was closing. I thought I was just tired every day because I'm a mom, or I was working full time and going to school. So it was just, I always had excuses for something, and found out that not only did I have TMJ, not only did I have an underlying sleep breathing disorder, that I found out I had a tongue tie. And the other part too, being in dentistry for so long, I would always look at my teeth. And one of the things that I had with my teeth is I had what's called an open bite with my teeth. And my tongue, I found out later, one of the dentists that I worked with, he's all, well, that's because you have a tongue thrust, and your tongue keeps pushing on your teeth. And so it would create this open bite. And I went through ortho 3 different times because I'm in dentistry, and I said, I got to close that open bite again. And I first thought, maybe I'm not wearing my retainer. I'm not wearing my retainer. But that's it. When we got down to the root cause, it was because I had a tongue thrust. Come to find out later on, that tongue thrust was because my tongue was tied. It couldn't go up. It could only thrust forward. So fast forward to now, that kind of led me to believe, okay, because where my tongue was lying, where it was open, that led to my TMJ symptoms. And because I had a tongue tie, when I would sleep, it would fall back, my jaw would fall back, and my tongue would close off my airway. So now that's led to my sleep breathing disorder. Anyways, so as we get into all this, I said, you know what? I think I need to actually release my tongue. I did my exercises, released my tongue. My sleep has gotten better. I have no more clicking and popping in my jaw. I just did a follow-up sleep study to confirm that my apnea has gotten better, and I'm waiting for the results. But I can tell you I feel much better. The quality of sleep I've been getting is so much better. I don't wake up with a headache anymore. So if somebody had told me that this little piece of string, would affect so much, I wish I had it cut as an infant.
So what are some downstream health effects if you don't get that corrected?
If you don't get it corrected, it depends on how you are and how much you can compensate. I see a lot of people that continue to have TMJ issues, that continue to have a sleep breathing disorder. They don't know that their lack of oxygen could be because the jaw or the tongue is closing off their airway. And a lot of times too, when the body, so it's interesting because we can live without food or water for days, but oxygen is a different story, right? We can only live seconds. The body will do anything it can to try and open that airway. If that jaw falls back and the body is trying to say, hey, Minette, wake up. Sometimes that's why those people have clenching and grinding, is because it's trying to find a way to open up the airway. Sometimes at a compensation of the teeth just being in the way. And so a lot of people have that clenching and grinding issue in their sleep, and they wake up the next day, they're like, oh my gosh, my jaws are so sore, or I have a headache, or my teeth, everything hurts. Well, because maybe in their sleep they were doing something that they didn't know about, and that was just their body trying to open up for air, trying to breathe.
And isn't sleep apnea downstream effects or things like heart conditions and?
Yes, it can be linked to that. When you don't have the right amount of sleep and good quality sleep, that leads into a cascade of overall systemic diseases, right? Heart disease, high blood pressure. It can be linked to diabetes and now Alzheimer's, when they're not getting that oxygen to the brain. So it's periodontal disease, gum disease. So it just leads to a whole cascade of issues of systemic health that if they are not getting that proper sleep.
What's the training like to become a myofunctional therapist?
So as I mentioned, you have to have a license, either a speech language pathologist, hygienist, dentist, physical therapist. If you have your license to practice, it's additional training. It depends. There's courses that are an introductory course for 4 days, but there's courses that last for 10 to 12 months in that field, and it just depends on how much you want to take. When I first started, I took an introductory course, and it was interesting, opened my eyes a lot, but I said, this is not enough, I want to take more. So I took a more advanced course, and that really immersed me in there and really made me go in there and just really take on this learning process. So it is at least a good year of learning in addition to what you're already in your license background, right? So.
Yeah, and what would also be, so it's kind of interesting, you don't really hear of many professions where you have to have a different, or a somewhat related professional degree first, but your actual license is, then you have like a further layer of a different profession on top of it. That's pretty interesting that it's structured that way. But this is an older profession though, is it not?
Yes, myofunctional therapy the field of myofunctional therapy has been there since like 1918 when an orthodontist mentioned it in his books, Dr. Alfred Rogers. So it's been there in those books. It's just who did them. I think the first I remember reading the history books, they were talking about the first evidence of a tongue tie was when the midwives would just go in with their nail and when they see it on the baby and then just clip the tongue right then and there because they knew that would affect the lactation. So it's been there for a long time, but it's just not focused on. When these dentists are in school, when I was in hygiene school, we learned about the muscles, the bones, the nerves, that's it, just the bare minimum. But we didn't really learn about this connective tissue, what the effects of what it does to this, and what happens if it doesn't function properly, and all those interconnections. And so that's why I think that's why it's an advanced training, is dental hygiene school, dental school, it gets you the bare education, and you're going to need to further it more, and that's where it becomes a specialty. And just like when you see in dental school those doctors that go on to be oral surgeons or endodontists, it's a specialty as well, right?
And how long have you been working in this field?
I have been as a myofunctional therapist since 2021. I've been a hygienist since 2014 and just in dentistry since 2000. So over 24 years of just being in dentistry and seeing all this dysfunction, specifically airway dentistry since 2005, like really looking at sleep, whole body, and TMJ.
For the myofunctional therapist, is that like something else that you offer as a service, or do you have like separate companies that you work for, or how is that structured?
So for my myofunctional therapy, I decided as I was going through this, I wasn't sure how I wanted to go about. You can work within a dental office, you can work within a practice. As I started going into it, I thought, hey, why don't I open my own business, my own wellness clinic, so that way I can help as many people as I can. So in 2022, I opened my Exceptional Airways. It is a myofunctional therapy business here in Las Vegas. And I now work with multiple dentists here in town. I work with a release provider. I get referrals from pediatric dentists as well as, just general dentists and orthodontists here too, because the knowledge of airway and muscle dysfunction is becoming more and more prevalent, and people are seeing it more, and they're doing the research, and now they're looking for these people to help them. So, and there's not very many myofunctional therapists in Las Vegas in particular. There's not very many of us. So that's why I decided, let me go ahead and open up my own clinic. And now I've been working with multiple practices across the valley.
Seems like you're ahead of your time when it came to that. It's pretty insightful, because over the last few years, I've been recently seeing and reading books that have been talking more about airway, but you've been involved with it for quite a while. How did you first realize that was a thing, especially since you were ahead of the curve as far as when all the books were coming out?
One of the things that started is because of the doctors that I worked with. They were, in 2005, I worked at the Las Vegas Institute, which is a continuing education for dentists. They go and they learn outside of what they learned in dental school. And one of the biggest things that they talked about there is about muscles and airway and how it all relates to the pain that people are feeling. And as I started working there and my own eyes started opening up, and I couldn't unsee the things that I was seeing in patients. And even myself, as I mentioned, I was a TMJ patient for so many years, and I'm like, oh my gosh, well, maybe this is why I have this pain. And as I started learning and as I started seeing what I was seeing in my own self, in my own family, my kids, I was like, oh, this not many people know about. I need to learn more about this, and I need to go out there and I need to educate people about this. And that's what I love. You were absolutely right that there has been a lot of momentum within the last couple of years about airway, about sleep, about myofunctional therapy, and I love it. I love it. The more we educate, the more people we can help.
And as that field is growing, is it expanding to cover other things? Like, let's say somebody had some kind of an injury or they were in a car accident, or is more of like a trauma-based thing. Obviously, they might need surgery for that, depending on what it is that happened. But would that also be something that they might need a myofunctional therapist for afterwards?
So if it's something that, if that trauma or injury has to do something with orofacial muscles and they did have to have surgery and they need to retrain, myofunctional therapy can come in and help with that. If it's something that goes on here with the face. And with that being said, too, myofunctional therapy is also collaborative. I have a lot of patients, or clients, I should say, that I work with that, we're working on their, orofacial complex, but I can see that they have neck and shoulder pain, and because they've been compensating all their life. I work with a lot of physical therapists, chiropractors, massage therapists, craniosacral, because I can see that there's tension here that they need to have this worked on as well. So it's a collaborative approach. So I would refer them to these other body workers to be able to get the help that they need.
What's something that you see in your practice that is like common knowledge amongst your peers, but an average person wouldn't know it?
Probably the most common thing that I see in my myofunctional practice is mouth breathing. People always are coming to me, I mouth breathe, and their mouth is hanging open. Our noses were meant for breathing and smelling. Our mouths were meant for eating and talking. And the biggest thing is they say, well, mouth breathing, isn't that normal? That's the only way I can breathe. That's all I've ever known to breathe, how to breathe. And that's one of the main points of my myofunctional therapy is to promote nasal breathing. Because as I mentioned earlier, proper rest posture is tongue up, lips closed, and nasal breathing. But a lot of times if patients or clients have never used their nose at all, they don't even know how to breathe through their nose. And when you don't use it, you lose it. So that is one of the key points of myofunctional therapy, is to retrain people to use their nose. And people then always ask, well, why is my mouth breathing so bad? Because I feel like I get more air through my mouth. Well, there's so many things why mouth breathing is so bad, and one of the biggest things is nitric oxide. Nitric oxide is produced only in our sinuses, and nitric oxide is a really important molecule for opening up our airways and our passages. It's a vasodilator. It increases blood flow, circulation. It's a big enzyme. It's hormone regulator. It does so much, and it's only produced in the nose. Or in the nasal cavities, and in the oral cavity as well, but your lips stay closed. and breathing in through your nose. When you don't have that nitric oxide, then there's so many things that can happen systemically. As I mentioned, a lot of diseases systemic diseases that can happen from that. So the importance of nasal breathing is so, so important, but it is so, so common to see mouth breathing all the time, and patients have clients that nobody knows that they're even mouth breathing.
And I would assume that would affect other things too. I had someone else that was in the dentistry field tell me that they can tell that someone's a mouth breather by looking at their teeth.
100% I can tell, and that's one of the things I always ask my patients in hygiene when they're sitting in my chair and I'm cleaning their teeth is like, I was like, have you been mouth breathing? He's all, yeah. I said, do you have allergies right now? You can't breathe through your nose? Yeah, I do. Because as air goes through the mouth, it changes the oral environment. It causes a lot of dryness in the mouth, which can cause a lot more buildup. It can change the salivary flow. It can also change the pH in the mouth. And so that mouth breathing, you'll see a lot more buildup, a lot more inflammation in the gums. And so that's why one of the first things as a hygienist, when I put my hygiene hat on, I'm like looking at their teeth. I said, are you mouth breathing? And they're like, yes, I have been. My allergies have been so bad, and et cetera, et cetera. I've had a cold. Well, that's one of the things. When you are unable to breathe through your nose, your body's going to automatically default to get that oxygen. Whether it's the right way or not, it's going to get that oxygen, and a lot of times it ends up that people are mouth breathing.
And what's something that you've learned, but you wish you learned it sooner?
I wish somebody told me about tongue ties or this little piece of tissue so long ago, because that little piece of string can affect the whole body. As I told you, we learn about the muscles, the bones, all this, the nerves when we're in hygiene school, but that little piece of tissue and how it connects the rest of the body plays a big role.
What's something that you've been excited about lately?
So as I told you, I'm like, everywhere I look, I see people mouth breathing. That's all I see. I am so excited that I've always been a long life learner. And so I love to take new classes. I'm excited to take on this new functional breathing course. I took courses in Buteyko and some other breathing courses, but not everyone breathes the same way, right? And there's a couple of factors that play into it. So when I'm doing myofunctional therapy, sometimes it doesn't always work for one person. So I now have immersed myself into this functional breathing or dysfunctional breathing course where we can look at, okay, the biochemical aspect of that person's breathing, the biomechanical, the psychophysiological aspect of their breathing, and figure out, okay, what do we need to do to correct this mouth breathing habit? Is it not just lip taping? It's something beyond that.
Do you promote lip taping or no?
I promote lip taping only if, one, they can breathe through their nose, that their noses are clean. So I always promote they have to have a good nasal hygiene. Just like you brush your teeth twice a day, you have to clean your nose twice a day, making sure you can breathe through it properly. So I recommend lip taping only if they have a good nasal hygiene, they can breathe well through their nose, and lip taping only as a reminder to keep their lips closed, not to completely seal them shut. Lip taping is only just that slight little reminder, because if they start to open, then they'll get that little stimulus, oh, let me close again. It's not meant to completely shut off and block off that way. It's just that reminder, keep your lips closed.
What do you want to leave listeners with?
I want to leave listeners with knowing that if you have pain, if you feel tired, if you have sleep issues, if you have chronic pain that you don't really know where that stems from, I would seek out a myofunctional therapist, because our goals are to find out what the root cause is of that pain and dysfunction, whether it's going back to looking at your muscles, whether it's an airway issue, and we will help you find and connect with the right person, and even be that person to help you, guide you get rid of out of this pain.
And how can people find you?
They can visit my website at exceptionalairways.com. That's the best way and quickest way to reach out to me. I'm on Instagram as well, also at Exceptional Airways, and on Facebook.
Outstanding. We'll put all your stuff in the show notes, and I really appreciate your time today.
Thank you for having me.
We'd like to thank you for listening to La Vida Las Vegas podcast. We hope you enjoyed the time with our guests as much as we did. It would help us out so much if you could share, subscribe, or review our podcast, or any combination of the three. Thanks again, and remember to take care of yourself.